A few moments ago, we sent out to the media that the mayor has enacted an executive order, a stay-at-home order for all the citizens in the city of Mobile as well as the police jurisdiction. This order will go into effect Saturday night at 10 p.m. And it will last through midnight on April 30th. It establishes that safety curfew that those between those hours, unless there's an exception, everyone is asked to stay at home. All residents, I'm repeating this, in the city of Mobile and the police jurisdiction will adhere to this order. Order must not be taken lightly. This coronavirus has affected many of our citizens and has taken the lives of 4 in our county. I urge all citizens to log into our website to view the order. There are defined essential activities and essential businesses, as well as not just the definitions there, but it'll also give you a fairly clear understanding of which businesses can continue to operate and which people can be out on the road. One thing that is not exactly specified in the order is that we have found out and now know that the Mobile County Public School System teachers over the next probably Monday, Tuesday, they'll be going to school to take all of their materials out of their rooms. And we also have a period of time when college students are coming back to our universities to remove the materials, their books, clothes, and all from their rooms. They will not all come at one time. They'll be staged, but that would be an exception to what's in the order. We're creating what we know will be frequently asked questions. I know the media is going to want to ask me about specific businesses. I may or may not answer those because we want to make sure that the attorneys and those that created the order, that when we answer the question, we're not going to get conflicting messages on, well, he said this and somebody else told me that. So the answers will be posted on the city's website. We'll be working over the weekend, so if you have questions, you can send them in to us and we'll start cataloging them and answering them, so it hopefully will cut out the confusion. Also today, or later today, I'll be engaging the City Council to talk about the creation of an ordinance which will give the city the opportunity to have greater enforcement powers, and specifically what it will do, it will allow us to be able to give someone a ticket or qualified under UNCC instead of putting them in the car with a policeman and bringing them downtown, which we don't want to clog up the court system. We want to make sure that if you're out and you're not supposed to be, you'll be given a ticket which will be subject to a fine, and we need the City Council to work with us on establishing those fines. Now, every time you turn on the TV that you're hearing, to stay at home, this is to amplify that for our citizens, and it's just another step that we have taken in this quest to make sure that we keep you safe. I'm sure the media is going to say, Mayor, why are you doing this today? And my answer to that is that this morning on the phone call, which we have every morning at 8 o'clock, of which it's not just city employees, it's representatives of the Medical Society, and it's also a representative of the Mobile County Department of Health. As the conversation continued over the period of almost an hour, just the information that was being downloaded, it became apparent, now is the time to pull the trigger. You put that on top of information that we have internally, that this week we've had 39 runs for our paramedics to go to answer calls of people who were symptomatic of having breathing, respiratory problems at their homes. Every time that happens, our guys have to put on their full gear. So that has been a spike in that number. As we told you, that we are monitoring different statistics, but a lot of this has been subjective in nature about how we reached the decision. But we have felt like that today is the day, and I'm really appreciative of all those who are weighing in, giving us information, data to use for us to make the informed decisions. I'm going to, we have a couple of guests today to weigh in, and I would say that there are a lot of bases that need to be touched when you do an executive order, especially keep in mind we've never had a pandemic. So the collaboration between the city and the Mobile County Health Department, is probably better than it's ever been in the history. Certainly Dr. Asho's been around in his position longer than I have in mine. But in this quest to get this right, he has seen the order, he's approved the order. I'll let him address that. But also, we have sent it to the governor so that they are aware of what we're doing also. So, Dr. Asho.
Thank you, Mayor, and thank you for your city team's attention to COVID-19. We are very supportive of anything that helps people do the right thing. We've been talking about social distancing. It's now physical distancing that we would like to recommend 8 feet. We need to decrease activities and encourage people to do what is in their best interest and the health of the community. There have been other cities. Birmingham has done a like and similar event over and beyond what Jefferson County Health Department has done with activities, and we support other municipalities in the city of Mobile doing a like and similar events. We were prepared to consider a stay-at-home order for the county, which we are still in the draft phase. We shared it with the legal department of the city of Mobile and with other persons about do we need to make this go forward. We're optimistic that the governor may say something about stay at home. If you look at the demographic, the maps, you'll see that Mississippi has a stay at home order, Tennessee has a stay at home order, Georgia has a stay at home order, Florida has a stay at home order. So I commend the mayor, his staff, his team for doing this in the city, and we're prepared this afternoon or the first part of next week to do something very similar in the county, and I encourage other jurisdictions. Anything that the mayor does as far as curfew or anything, if we do have an order, it will not supersede the more stringent requirements that the city or any municipality wants to put in place. So thank you very much, Mayor. Thank you, City of Mobile. And again, I think this is encouraging people to do the right thing. And now we've got more people watching and help you have a good outcome for this viral illness. Thank you.
At about 10 minutes to 2 today, I had a phone call from Dr. Rubenstein, who's the mayor of Saraland. Having heard that we were going to do this, he asked me at 2 o'clock if I would get on the phone with some of the other mayors in Mobile County to apprise them of what we were doing. They were interested in taking our order and using it as a template for their communities. So in just a matter of a few minutes, we had that phone call. We forwarded them this information. So you may see something very similar to this coming out of Saraland, possibly Satsuma, Dauphin Island, but we were glad to be able to work with them. So at this time, I will ask I'll ask Director Jim Barber to come on and tell us, give us an update from his perspective.
Thank you, Mayor. And just to update you on our first responders, and this is going to be the COVID-19 antibody testing that we've been talking to you about. But over 800 first responders in the city of Mobile have been tested so far for the antibody. 10 positive results out of Mobile Fire Rescue Department, 23 positive results out of the Mobile Police Department, and today we are confirming the first Mobile police officer that has a positive confirmation for COVID-19, and that will be the PCR test you hear so much about, which is the nasal test. I do want to thank the doctors over at Diagnostic Medical who have done much of the heavy lifting on this antibody testing for us because it was their assistance that got so many first responders through. And remember, this just began Monday, so it's an enormous amount of people that they've tested. It is imperative that we make sure that we don't have confirmed cases of asymptomatic people with live virus that are carriers. These officers and first responders, the EMS, our firefighters, are in very close contact with the public. They're in physical contact with the public, and we have to know whether or not they have this virus so that we can make sure that we are quarantining until we do the confirmation PCR test. And so this is our way of making sure that we are protecting the public from people that may be asymptomatic and nonetheless may be carriers of the COVID-19 virus. We would also like to thank Dr. Kobe Harrison, Dr. Jason Harrison from Diagnostic Medical. They were the frontline doctors that performed these antibody tests for us. As far as 911 calls, the mayor referred to this. These are Signal 99 or medical distress involving illness, and these are people that are presenting with symptoms that are common to the COVID-19 virus. Again, 39 responses this week alone. Astronomical if you look at the history of our 911 calls. To give you a good example for comparison, the month of February, we only had 2 of these types of 911 calls, and yet we experienced 39 this week. That number seems to continue to increase. Talking to the frontline doctors, there is an increase in number of patients suspected of COVID-19, an increase in admissions into the hospital because of people suspected of COVID-19 that are having respiratory problems or difficulty breathing. There is also an increase in the use of ventilators that you heard us talk about. We seem to be okay right now, but that is increasing as well. So all of those factors and discussions with the mayor prompted the executive staff to certainly support the idea that we do this stay-at-home order. And I'll be around for any questioning after this.
During these briefings, we have had representatives of all the hospitals join us at different times. I want citizens of Mobile to understand that our remarks are not meant to favor one hospital over another hospital. But I can tell you, as a community, we are very, very fortunate to have our 4 hospitals whom are collaborating, who are swapping information, who are trying to help one another, and we are on the phone with them every single day, finding out what can we do to help support them to support you. So again, I just want to thank them for their cooperation and participation in this. You've been hearing us talk for 2 weeks now about Ladd Stadium and having a testing site. Yesterday when I went at probably 10 o'clock in the morning, the tents were all set up. Everything was prepared. Today when I went, there were actually cars driving through. Synergy Labs was present. And so by next week, is my understanding, there'll be more to come. But one of the individuals that's been very instrumental in making that happen is Natalie Fox, who I'll ask Natalie to come up and make a few remarks about what you'll find and see at Ladd Stadium.
Thank you, Mayor. And again, I'm Natalie Fox. I'm Assistant Administrator and Chief Nursing Officer for USA Health's Physician Group Practices. So USA Health began drive-through testing for our patients and our employees on March 12th. We are very excited to be partnering with the City of Mobile to offer public testing to increase the availability of testing on Monday, April 6th. So if you believe that you need to be tested, we will have a hotline that you can call. It is 1-888-USA-2650. Those phones will not open until Monday morning at 8 a.m. They will be open Monday through Friday from 8 to 2. During that phone call, you can expect to go through a series of triage questions that are based on the CDC guidelines to understand if you meet criteria for testing. If you do indeed meet criteria, you will be scheduled for a medical evaluation with a healthcare provider that will be conducted over your smartphone device or just over your telephone. After that, you will be scheduled for testing at Ladd. When you arrive at Ladd, there will be a series of checkpoints that you will go through, so please be prepared to have your ID ready. And then a healthcare provider dressed in personal protective equipment will come to your car and they will perform the PCR test that you just heard Director Barber mention. That is the nasal swab and/or throat swab that actually detects the presence of virus in your secretions. The reason that's so important is because that's what lets us know that you indeed do have the infection and that you can also spread it to others. So that is considered the gold standard diagnostic test. We anticipate these results will be available in around 72 hours, but again, that depends on the volume of testing and the lab that's performing that test to be able to process the results. We will be giving all patients information how to access our patient portal to gain these results, as well as phone calls if anyone is positive with further follow-up instructions. If you are a USA Health patient, we do ask that you continue to contact your USA Healthcare provider because they can arrange for testing like they've been doing since March 12th for you. So again, I want to thank the City of Mobile for all their support. It's been a lot of work from all of our parts to get this ready, and we are excited for Monday to open up the availability of testing for Greater Mobile area. Thank you.
So at this time, I'll be glad, and Dr. Eichel, if you'll come closer in case this, I know there'll be questions for you also. So I'll open the floor up.
Several questions.
Go.
This says stay-at-home order. Does this only apply between the hours of 10 p.m. and 5
No,
a.m.?
no, the order, there's a curfew, okay? And if you use the term just curfew, it's from 10 p.m. to 5 a.m. There are a lot of other definitions and essential businesses that help define who else is staying at home, okay? The idea is that there will be some people out during the course of the day, but things pretty much are shut down from 10 to 5. And it's the degree of how it's closed down.
What does this order do to change? I mean, grocery stores are still open, hardware stores are still open. Does any of that change with this order? Is there anything new that we need to think about closing?
Dale, there are new things, but that's when I made the comment about the frequently asked questions, instead of me mentioning 2 right now and there being 8, I would rather that come under the frequently asked questions so that we don't send confusion. People can read the order, and even upon reading it, I know there's going to be questions, but those can only be answered, and I prefer it to be in writing rather than be misleading.
When will those be available?
So I'm sure questions could possibly be coming in right now, and we'll be working over the weekend. We'll have a staff working on it, and by Monday morning, I believe that by and large, the majority of them should have been answered, if not all of them, so that you'll have clearer definition on Monday.
So outside of the order, what is really changing? Or excuse me, outside of the curfew, what is really changing from this
So again, it goes back to the encouragement of staying at home. I mean, we've done a better job of defining who can go to work and who can't work. Okay.
So why the overnight hours? The 10 p.m. to 5 a.m. instead of maybe sometime during the day when there's
Well, if you look at what curfews typically do, you're trying to keep people off the street, period, okay? And looking around at other communities of what they've done, you will see that not everybody, but most people have a defined curfew time. And so that is part of this order.
How will this be enforced? How are the police going to enforce that? And let me give you an example. Are you going to pull me if I'm driving at 4 a.m.? Are you going to pull me over and ask me questions about how I'm coming to work?
Yes.
How is this going to be enforced?
You have to assume that a policeman will pull you. I mean, a policeman has the right and the authority and the direction to pull you over and ask you where are you going, and if you can show evidence that you are going to the infirmary health system, or that your mother is in cardiac arrest or some emergency medical situation, they're going to allow you to go on. But if you can't give them a valid reason of why you are out, then you will be given a ticket and a fine. That's why I said that we will be talking with this, engaging the city council to identify exactly how that'll be done. Yep. To what now? And so there's a definition of essential activities in there.
Can you tell us a little, like some of those essential activities that like, the average person might be doing?
So again, I don't want to be evasive here, but I don't want to, unless I read them all, it's going to be misleading. So you can go on the website and you can see what the essential activities are, and you can find out. So I'm not trying to be evasive. I'm trying to be more accurate. Yep. Any questions for Dr. Isho?
I don't have any questions for Dr. Russell. I have questions for the Chief.
Okay, Director.
Go ahead, Dale.
Yeah, I'm sorry. Let me, if she's got one ready,
So when it comes to these rescue workers, fire rescue workers, do they have, this protective gear for themselves, when they're out and about, on the streets?
They do, and the question is, does the Mobile Fire Rescue Department carry with them all the appropriate PPE or the personal protective equipment? They do. Just like the hospitals, it's been a struggle to maintain that supply. Currently, we do have a sufficient supply, and we've been working pretty close with the hospitals to make sure their off-site testing sites are properly supplied as well. But when we refer to the Signal 99 responses, we're talking about an infectious disease response. And so when we're talking about a full set of equipment, we're talking about the mask everybody hears about, the N95 mask, the face shield, the gown, and latex gloves.
So those have all been used with those 39 positive correct?
Correct. And so you can see how quickly we're using these supplies, not just at our test sites, but in response to emergency calls for service. And so that's why it's critical that we keep those supply chains moving.
Are y'all going to continue, are y'all going to continue to use those, when it comes to this curfew, when those people are out and about that, may not should be, when you guys are possibly giving out these tickets or something?
I think the question is, are we going to use PPE during in contacts? If we can't maintain a 6-foot distance from somebody that we're questioning or something, then it would be appropriate to use the PPE. Or if we're responding to a location or house to where there's known infection in the house, whether suspected COVID-19, certainly again appropriate to use that PPE. We have now indicated that part of the 911 questioning when they call you, they will ask you about illness, either previous or current illness within that house, so that we can warn the officers that are responding whether or not to apply PPE before they arrive.
You said you had over 800 first responders tested in the city. That's what I was looking up, by the way. Have all of those test results come back on the antibodies? Are we pretty confident that the 33 that you mentioned are going to be hit as far as antibodies?
So the question is, out of the over 800 first responders that are tested, do we have all the antivirus or the antibody kits or the results? And the answer is yes. It only takes about 10 or 15 minutes to get those results from the rapid test. And so we're able to do that very quickly, unlike the PCR test, which is what you're hearing is so backlogged.
And you said that there was one officer that tested positive on the swab test. How many of those tests have come back at this point? How many results? If let's say you swab tested all 33, how many of those have come back?
Well, that's a difficult number for us to apply because they're not notifying us of how many swabs are out or in. And so what we're getting is the confirmation of the individual officer or firefighter on whether or not they have COVID. And so we're waiting for that. Again, we just started Monday. We had hoped to have results by Wednesday afternoon, and here we are Friday with the first results coming in. And so it's been a difficult process. We are very confident that process will improve going forward, though.
Do you expect to see more positive results from the swab tests for first responders, more than one?
I do. If we trend like the rest of the country is trending, I do expect. I don't think it was a surprise to see that we did have a confirmed case of COVID-19 within our first responders. Again, I'll remind you, the first responders are in a unique position in that they're in very close physical contact with the public at all times. And so they're uniquely, and that's why you see a disproportionate number of police officers versus firefighters.
And then my last question for you, Chief. Of the 33 positive antibody tests, are we still at one that showed any symptoms, like everybody else was asymptomatic?
Only one that showed very mild symptoms out of those 33 that tested positive for the COVID antivirus. Now, I will tell you, the one that confirmed COVID-19 case through the PCR test was symptomatic.
Okay. So we're looking at like 2 that were symptomatic that you know of the 33 tested?
I know of 2 that were tested with PCR that were symptomatic during this process, but there are other officers. We have gotten some symptomatic cases that came back negative for COVID-19 as well, but I just don't have that number of negative cases. We seem to be.
And then I do have one more question. You mentioned the February numbers for ambulance rides or
Calls for service.
yeah, calls for service at 2. Was that for the whole month, and was that referring to respiratory illness type symptoms?
Yeah, so the question is, out of the 2 that was for February, was that the entire month, and was that respiratory related 911? And yes, that was all we had in February for respiratory rate, like infectious disease calls that required that full setup year. Yeah. And so now out of the 39, I can't tell you how many were transported because there is a triage that's conducted to check the blood saturation, oxygen saturation. And so we're following certain guidelines on that so we don't overwhelm the hospitals with patients that should not be hospitalized. So I guess if I understand the question, are people calling 911 just to ask questions about the virus?
Virus related, whether it's trying to get an ambulance or just to talk about any of their concerns.
Okay, so the question is, are people calling 911 to either get an ambulance or to ask questions about COVID-19? I would imagine that does happen. People call 911 because it's an easy number to remember. It's an inappropriate use of 911 to call it to ask questions about COVID-19. There's plenty of information out there. Certainly the health department can help anybody that needs to answer questions. It's on every one of the hospital websites. And so calling 911 because you're in some type of respiratory distress, then certainly that is appropriate, but it's an inappropriate use of that system to just ask questions, and we will certainly reroute you somewhere else. When we talk about this type of run, there's the basic protection, which is gloves and mask. But when we're talking about an infectious run where somebody's presenting fever, cough, and shortness of breath, that's a full setup. I mean, that's the mask with the face shield, that's a gown, and that's gloves. And so we're trying to make sure that we protect our first responders from that. Do also understand that a lot of these cases that officers, if there's known illness, may ask the patient to step outside of the house rather than us come into the house to take reports, and also to put on a surgical mask, because I believe all the patients that are tested for COVID are given these surgical masks so that they can prevent contaminating other people. All right.
No, 6 foot is the physical. We've been using the term social distancing, and we think that that's not effective for people to really understand. So we're now defining it better as 6 foot physical distance, so that people get it. If you want to do social gathering, do that on Facebook, and that's the way to gather with as many of your friends as you want, and you can cut and paste. But right now, during these this high endemic and epidemic virus, we really need to be careful. Just on personal protective equipment, for an idea of how much is used, my understanding is the University of Alabama at Birmingham is using almost 3,000 sets of PPE a day. So for healthcare providers trying to be ready to do their business, it's very, very important. And in Italy, 51 or 52 healthcare providers, doctors died because they were really not able to have the necessary personal protective equipment constantly. So this is a serious problem. So saving PPE for our first responders, for our hospitals, for the people who are providing care, there's been talk about everybody wearing masks, and actually the regular surgical mask protects the other person, doesn't really protect you. So that's when you go to the dentist office and the dentist is looking at you, the mask he's wearing, or the mask, if any of y'all have had surgery, the little mask they're wearing is to keep the doctor's germs from going to the patient. So that's been suggested by senior people to give everybody masks, but the idea is not to protect the individual wearing the mask, it's to protect, unless it's an N95, And N95 has to be fitted, and it's a respirator type device, so it's much more expensive, a much more better device to protect the individual.
So you wouldn't necessarily suggest people that are just, go to the grocery store and wear a mask?
Well, if you have any symptoms at all, if you happen to have anything, then try to get somebody else to go to the grocery store, go out for you. So we do not want people who have any symptoms of being ill to engage. So they need to physically distance. And even in the household, they need to separate themselves from their family members that they love. But in the case that everybody's probably been on an airplane and seen somebody with a mask, those most of the times are probably been people who had a history of a positive skin test for tuberculosis, and they're on treatment, but that is to protect anybody else who may be around them from them giving the other individuals what their illness is. Thank you.
I just want to make a clarification on the question. I can give you a pretty quick and simple answer. What is the difference in what we're doing today with this executive order and what we've been operating under? We've actually been operating under the order that was delivered, put out by the governor and by the Mobile County Department of Health regarding our restaurants. So operating under those, there was a lot of encouragement on our part and messaging about following those orders. This is much different in that this is a mandate to stay at home. And this is an executive order from the mayor's office that would supersede those orders. This is a stay-at-home order. And that's why we talk about the enforcement, the ability to levy fines, why you may be pulled over if you're on the street and have to have identification of why you're out and about. I think that's what you were asking earlier, one of you were asking earlier, and I didn't articulate that clearly, but does that answer the question now? Yes. Yes. Yep.
So, for the past couple of days, I've had my colleagues come out here and kind of asking why not issue a stay-at-home order yet. But I know you said today was the right day to do it, and there were a couple of factors that went into making that decision. Are you able to speak more on why today?
Well, I think we addressed that already. Why is it today that we did it? And we talked about, the conversations that we had with the task force at 8 o'clock this morning. You heard what was said about the paramedics having more runs for respiratory illnesses. One thing I did not mention was that in conversations with the hospitals, there does appear that in their IC units having to do with respiratory problems, there's been an increased number of patients. But so those statistics, those some of the subjective feelings, they're not all statistics. But that is, again, why we made the decision today, was by pulling that all together. Any other questions? Well, I want to thank Dr. Isho for his support in this, and I want to thank all the hospitals. Appreciate Natalie being here. She's really made it happen out at Ladd Stadium, and Director Barber for what he's done. I hope everybody understands that this last 5 days, that everybody I know that's involved with this has done things that they've never done before. I mean, every day we're trying to find more PPE to protect you. We're trying to trying to create collaboration that's never maybe gone on in the past, getting people to talk one another. We've opened doors that have been closed, and we will continue to do that, because yesterday's, no, I can't do that. Circumstances change, and so today they can do that. And what we've done today is, I feel certain that it's the right time. And if you think back the analogy of the hurricane and the feeder bands coming in, it's getting closer. But if you think about your preparation for a hurricane, you start hearing about it, you start thinking about it, and you start doing a few things. The day before you do a whole lot more things. And then you finally have everything in preparation. You feel like it's here, and this is why you've needed to act. And so this was the day that we needed to act. And the whole effort has been in anticipation of trying to protect your health and your safety, while at the same time allowing those that could work continue to do that. But it's a new day. We're under a new operating order. And if anything changes between now and then we need to do differently than what we've done today based on new information, we will tell you the changes that will be made. Thank you for being here.